Hello everyone, good afternoon. I'm Dr. Mansi from Homeopathy 360 and I'm very happy to say that today we have another session on another day on Homeopathy 360. Today we have Dr. Deepika Gupta, BHMS, MD, specialization in pediatric and autoimmune disorders since 12 years. It's a very long journey, ma'am. A warm welcome to you.
Thank you so much, Mansi. Thank you so much.
So let's have a short introduction of Dr. Deepika Gupta. Dr. Deepika is a dedicated and experienced homeopathic physician having specialization in holistic treatment since 12 years at Gurugram. She has been dealing with pediatric and autoimmune disorders and has gained experience in these cases all over the years. She is also a part of My Nation Hope Foundation, where she has been curing patients via counseling sessions as well as homeopathic medicines. Her expertise lies in addressing a wide range of health concerns, including chronic disease and lifestyle disorders. She combines traditional homeopathic knowledge with modern insights to help patients achieve optimum health and recover speedily. She also gave clinical tips on her social media, and it's very uh, inspiring to see such passionate homeopaths, and it's really very good to see the such miracles happened in homeopathy. So, ma'am, we welcome you on the platform of Homeopathy 360, and we have a very interesting topic today. I would like that please, ma'am, share your topic and your presentation because we are waiting to gain knowledge from you.
Thank you, Homeopathy 360, for inviting me to give a webinar. First of all, I should thank, and the topic for today is maternal stress factors leading to physical, emotional, and neurodevelopmental disorders in children. Shall I take the
Okay,
platform
ma'am.
now?
Yes, ma'am, the platform is all yours. And let
Okay.
me share the screen, then
Yeah.
we will have the presentation.
बैठते हैं मैं तो इसे सिर्फ मुझे So, hi everyone, I am Dr. Deepika Gupta, attaining specialization in pediatrics and autoimmune disorders. I focus on diagnosing and managing complex conditions in children and patients with autoimmune disorders so that they receive the best possible care for the healthy future. Today I'm going to tell you the maternal stress factors which leads to the physical, emotional and neurodevelopmental disorders in children. We'll focus on the intrauterine life of the female and what are the effects of those stresses on the child. Pregnancy generally is a time of joy, happiness for a female, but for some, it brings a feeling of sadness, depression, anxiety, worry, getting stressed due to the circumstances. As a physician, it is very important to acknowledge her feelings without judgment. We are going to take into account mother का grief, mother का anger, उसका shock, fright during pregnancy, which led the child develop these kind of congenital abnormalities. We generally consider the characteristics of the child कि बच्चा ऐसा था, he was hyperactive, he was striking, he was hitting. But in ADHD, autism, other cases as also pediatric cases, we have to consider कि ऐसा क्यों हुआ था? What was the state of mother while she was carrying the child in her womb? These factors are very important in prescription of pediatric cases so that the child becomes totally normal. Maternal stress factors affecting the emotional makeup of the child are internal stress factors and external stress factors. External stress factors, what do you understand by external stress factors? Do anyone have to say anything about external stress factors? What do you understand? Because I want it to be an interactive session, not us कि मैं सिर्फ बोल रही हूँ and you are not giving the inputs. Does anyone want to give inputs? What do you understand by external stress factors and what do you understand by internal stress factors? Okay. So I'll tell you external stress factors कौन से होते हैं. External stress factors are relationship with the husband. सबसे पहला रिलेशन एक फीमेल का विद द हस्बैंड होता है विच अफेक्ट्स हर इमोशनल डेवलपमेंट emotions. If the relationship with the husband is not good, that is, if she is feeling neglected, she is feeling supported, she is feeling abused, she is feeling criticized by her husband, या फिर उसका husband दूर चला गया and she has cares for him, that also affect the development of the child. Next factor, external stress factor, is relationship with the other family members. Whether she is getting affected by all the people who are staying with her, what emotions she is carrying during pregnancy. सारे लोग जो घर में रह रहे हैं, उनसे bond कैसा है, उनसे relation कैसा है, that we have to consider during pregnancy for the prescription of the child. Attitudes of close relatives and friends. मैं अकेली रह गई ड्यूरिंग प्रेगनेंसी, मेरा कोई रिलेटिव मुझे पूछने भी नहीं आया. इफ वी गेट दिस काइंड ऑफ सिनेरियो, we take the delusion alone she was, nobody came to visit her. Then whether she was treated properly by the relatives or she was despised by the relatives. I'll share a case with you where a dark complexioned female told कि उसकी pregnancy में relatives ऐसा कहते थे कि तू तो इतनी डार्क है, तेरा बच्चा भी ऐसा ही गंदा प्रोड्यूस हो, ऐसा ही गंदा होगा. So that she was unable to take this kind of scorn, despise from the relatives, whereby the child developed complaints. Next factor which we have to consider is economic status of the family. Economic status of the family is very important to carry on the pregnancy. अ केस ऑफ एन अनप्लान्ड प्रेगनेंसी जिसमें कि हस्बैंड और वाइफ सिर्फ वर्क करते थे, सपोर्ट करते थे फैमिली को, बट व्हेन शी गॉट प्रेग्नेंट शी फेल्ट कि मैं फाइनेंशियली कैसे सपोर्ट कर पाऊंगी, फाइनेंशियल नीड्स को कैसे पूरा कर पाऊंगी विद द सेकेंड प्रेगनेंसी. देयर आई टुक द डिल्यूजन स्टार. So how you are understanding how we have to take the delusions and the where we have to match the history with the delusions so that we can prescribe to the child. Next we have internal stress factors. Internal stress factors is Internal stress factors are very important for prescription of the child that is not wanting to have a baby at all. In case of unplanned pregnancy, we generally get this symptom कि मुझे तो बच्चा चाहिए ही नहीं, मैं कैरी फॉरवर्ड करूं या नहीं करूं. There's a lot of confusion. What do I do? We have to take it into account for the prescription. A lot of females say not wanting to leave the party and alcohol. सो एक केस में आई हर्ड कि सेकेंड ट्राइमेस्टर में शी कंटिन्यूड सेकेंड ट्राइमेस्टर तक शी कंटिन्यू ड्रिंकिंग, बट थर्ड ट्राइमेस्टर में उसको फियर हो गया कि बच्चा ठीक होगा या नहीं होगा. सो देयर द फियर ऑफ कंजेनाइटल एबनॉर्मेलिटी came in the child. Then strong desire to have a baby of a particular sex. मेरा बेटा ही होना चाहिए इस बार, ये बहुत कॉमनली मिलता है हम लोगों को ड्यूरिंग प्रेगनेंसी. वी हैव टू टेक इट इनटू अकाउंट. लाइक आई शेयर अ केस विद यू जहाँ पे पहली गर्ल चाइल्ड बॉर्न हुई थी, बट सिस्टर इन लॉ को शी हैड अ बेबी बॉय. उसको इतना नेग्लेक्टेड फील हुआ, इतना खराब फील कराया फैमिली ने, दैट शी डेवलप्ड कि इस बार तो मेरा दैट शी डेवलप दैट फीलिंग कि इस बार तो मेरा लड़का ही होना चाहिए. थ्रू आउट प्रेगनेंसी शी हैड अ स्ट्रेस कि लड़का ही होना चाहिए, विच गेव पामो प्लांटर सोरियासिस टू द चाइल्ड सिंस चाइल्डहुड, सिंस बर्थ. Then is not wanting to have a miscarriage. ऐसा भी फीलिंग रहता है फीमेल्स को कि मेरा मिसकैरेज ना हो जाए. अ केस आई वुड शेयर इज कि हेड ऑफ द फैमिली की डेथ हो गई थी ड्यूरिंग प्रेगनेंसी, आफ्टर विच ही बिकेम वेरी कॉशियस कि ये सारे जो सैडनेस प्रोड्यूस कर रहे हैं घर में रो रो के, हर समय ऐसा माहौल रहता है कि जैसे पता नहीं क्या हो गया है, मेरे बच्चे को कुछ ना हो जाए ड्यूरिंग प्रेगनेंसी, मुझे ऐसा फीलिंग था. सो शी वॉज केयरफुल ऑफ शी वॉज वेरी कॉशियस ड्यूरिंग प्रेगनेंसी. वी हैव स्कॉन फॉर द चाइल्ड ऑल्सो वी गेट ड्यूरिंग प्रेगनेंसी कि मैं इस फैमिली को अपना बच्चा नहीं दूंगी, इन्होंने मुझे इतना परेशान किया है, मैं इस बच्चे को ही मार दूंगी. दैट इज द कंटेम्प्ट फीलिंग फॉर द child. Then not wanting to decrease the performance at office. बहुत सारी फीमेल्स को ऐसा लगता है कि कंसेप्शन हो गया है, सो आई मेरी परफॉर्मेंस पता नहीं ऑफिस में कम ना हो जाए या मैं जॉब नहीं स्विच कर पाऊंगी. सो वी विल कंसिडर इट एज इंडस्ट्रियसनेस इन अ फीमेल. रिलेशनशिप सबसे इम्पोर्टेंट वाइफ और हस्बैंड का है, जिस विच प्लेज अ क्रूशियल रोल इन इमोशनल वेलबींग एंड ओवरऑल डेवलपमेंट ऑफ द चाइल्ड. Intrauterine history of mother is a gateway to understand and select the simillimum to cure the child with diseases like autism, ADHD, dyslexia, Down syndrome. We have to consider mother's grief, mother's fright, mother's anger during pregnancy, which leads to the emotional development of the child. The most important thing which I used to lack in curing the neurodevelopmental disorders is interpretation of verbatim to rubrics. I used to listen to the whole history, but इसको interpret कैसे करूँ, इसको rubrics में convert कैसे करूँ, that I used to struggle with. Over a period of time, I realized कि what the patient is saying, that verbatim has to be converted into rubrics. You need to read and read a lot of rubrics for that. You need to have a lot of interpretation of the rubrics, which requires a lot of dedication and reading of the rubrics every day. I want to share a few cases with you, but before that, I would again ask you, is there a problem in understanding, or do you have any questions before we switch on, before we start the cases? Anyone wants to ask the questions? सबको सब कुछ क्लियर हो गया? There are no doubts? Nothing you want to ask? Or any inputs if somebody wants to, add on to the point as well. कि ऐसे भी तो इंटरनल स्ट्रेस फैक्टर्स हो सकते हैं, ऐसे भी तो एक्सटर्नल स्ट्रेस फैक्टर्स हो सकते हैं. यू कैन ऑल्सो एड ऑन टू द नॉलेज. Okay, so we'll start with the case. With the help of few cases, I'll make you understand how to convert verbatim to the rubric. But first of all, I would like to tell you that observation of the patient as soon as he enters the clinic is very important. A child entered the clinic, he came and वो मेरा लैपटॉप को अलाइन करने लगा. Expensive pens in the pen stand को he segregated with the non-expensive pens. Books को straight कर दिया उसने. He was too properly dressed and he was 6-year-old child aligning my things, properly dressed. Would you like to give the suggestions for the remedies? I want now suggestions of the remedies. Whatever you're thinking. Fastidious remedies. Nobody knows the fastidious remedies. Depending upon the symptoms of bronchitis, including the symptoms of bronchitis, I prescribed arsenic to that child. क्योंकि bronchitis के symptoms से भी match हो रहा था and the appearance and behavior of the child was also of arsenic. Now is the case of a child. First is the case of a child of 3 years who was brought for the treatment of autism. This case is of autism. He was making 3 years child who was making no eye contact with me at all. He was silently sitting at a chair and he was doing no activity. जैसे उसके पेरेंट्स उसे लाए थे वो वैसे ही बैठ गया. He was not even looking here and there. He was just sitting. His parents said that he says no to every sentence. Naksh, आपने खाना खाया? He would say no. Naksh, what did you eat in lunch? He would say no. What I observed is he was just playing with the car keys, and parents also told me that he does not play with the toys, he just plays with the car keys because he's very comfortable with the car keys. Parents used to avoid going out because नक्श को बाहर जाना पसंद नहीं था. He used to avoid any interaction or any crowd. So parents ने भी बाहर जाना बिल्कुल बंद कर दिया था. He used to hide himself in a room if he knew कि people घर पे कोई strangers आए हैं. He would love to see revolving flashlight of a toy at the roof, which he could do for hours. These are the symptoms: repetitive behavior, not talking, not making an eye contact. These are the symptoms we get in an autistic child. When parents asked him to wish me or talk to me, he didn't make any gesture. He just had a mask like face. Next step was to take the intrauterine history of the mother. She said that she got pregnant in 2019 after 2 months of lockdown. Lockdown, as you all know, itself was a period of mute where we all got mute. So, a lot of females gave birth to autistic children in this period at this period of time. Her in-laws shifted to her place, which was not the scenario before. Lockdown में her in-laws shifted to her place, to their place, and she was not comfortable with that scenario. Husband used to help her in daily chores earlier, which after the parents shifted with them, he stopped helping her. She was not getting any help from any family member. She had anger towards the husband, and as nobody used to help her in work. They all used to sit and talk, बातें कर रहे हैं आपस में, लेकिन मेरे से कोई भी नहीं पूछ रहा है कि मुझे किसी भी चीज की या हेल्प की जरूरत है. She eventually developed anger towards the husband. She used to feel कि in-laws के आने के बाद ये सारे एक तरफ हो गए, including my husband, and मैं अकेली रह गई. घुटन फील होती थी मुझे इस सिनेरियो में. कहीं बाहर नहीं जा सकती, प्लस हस्बैंड भी बात नहीं सुन रहे. Even after sharing all my problems, he is not listening and catering to my needs. She lost all her confidence during pregnancy, and her emotions got mute during pregnancy, which we can see in the child. Rubrics. What rubrics did I take? Or what rubrics can you think of? Any rubrics, simple rubrics you can share. Anger husband towards सबसे पहला और simple rubric which I took. So other rubrics which you would take in this case, you can share. Any guesses for the rubrics? Any suggestions for the rubrics? Rubrics selected were anger, husband towards, anger, vexation about, former, confidence, want of self-confidence, self-depreciation, delusion, alone being, castaway being इस इस केस का बहुत इंपॉर्टेंट रूब्रिक है बिकॉज उसको ऐसा लगा था दैट दे ऑल आर एट वन साइड एंड आई एम अलोन सो जो कास्टअवे वाली फीलिंग थी दिस डिल्यूजन इज वेरी इंपॉर्टेंट इन दिस केस विच आई टुक and the other rubric was delusion enclosed she is because बंद हो गई थी घर में सिर्फ काम ही करे जा रही थी. The medicine selected, so I'll leave the medicine which was selected. You all can tell me the medicine which you think can be given in this case. No suggestions for the medicine? Germanium met 1M was prescribed. Why germanium met was prescribed? जर्मेनियम मेट को ऐसा फीलिंग होता है दैट शी हैज बीन ट्रैप्ड एनक्लोज्ड सारे एक तरफ हो गए कास्टअवे फीलिंग मैं अकेली रह गई दैट फीलिंग इज देयर शी जर्मेनियम मेट ऑलवेज फील्स एंगर टुवर्ड्स हस्बैंड what is the difference between submissive remedies and the जो रेमेडीज रिटेलिएट करती हैं जर्मेनियम मेट इज नॉट रिटेलिएटिंग रेमेडी शी वुड गेट सप्रेस्ड like triticum like carcinosin they are submissive remedies whereas I did not selected a snake remedy जो कि retaliate करती काम करना छोड़ देती या फिर verbally she would have said something to the in-laws or told her husband ki I am not going to do this work. There are a set of servile remedies, there are a set of animal remedies. We should know the characteristic of all these remedies. Metal remedies के क्या characteristic होते हैं, servile remedies के क्या characteristic होते हैं, animal remedies के क्या characteristic हैं, mineral remedies के क्या characteristic हैं. Along with the delusions, along with the totality of the picture, we have to prescribe. Next case I'll take up is of the ADHD. So this is a case of a ADHD child, 3.8 years old, who came with her nani nanu because the mother was separated from the father. Patient said, the mother of the patient said that child has been restless since birth. She bangs her head in anger. She gets scared of loud noises like moving vehicles. कुकर का whistle से इतना डर जाती है that she gets so scared with the loud noises. There is no control over urine and stool. The child was communicative. That was my observation कि child is very communicative है. She was constantly saying, Nani bimar, Nani bimar hai, Nani bimar hai. So the child was continuously telling me कि इनको भी medicine दे दो. She was exploring everything at the clinic and she has an addiction to watching YouTube to an extent कि अगर फोन नहीं दिया जाता था she used to lie down on the floor and throw temper tantrums. Even if she get hurts, she used to strike her legs and hands on the floor. She tippy-toes whenever she goes to the kitchen, takes out an ice cream and would have it. Juices she would spill on the floor, taking out from the fridge. She used to do all the these were the characteristic things she used to do at her house and she was doing at the clinic. She likes to scatter all the toys in the room and does not clean up. In this case, along with the characteristic of the child, we are going to consider the intrauterine history of the mother, which was mother of the child share कि husband was narcissist personality, which she got to know after marriage. शी सेड मुझे मैरिज से पहले नहीं पता था कि वो ऐसा निकलेगा, दैट इतने टेम्पर टैंट्रम्स, इतने एंगर इश्यूज उसकी पर्सनालिटी में है कि सिर्फ अपने बारे में ही सोचता है और अगर उसके अकॉर्डिंग काम नहीं करो तो टेबल थ्रो कर देना एंड इतना गुस्सा कर देना कि फोन फेंक देना. आई कुड नॉट टॉलरेट ऑल दिस आफ्टर मैरिज, बट आई गॉट टू नो कि आफ्टर 3 months ऑफ मैरिज आई एम प्रेग्नेंट. She was abused verbally and physically even after knowing that she is pregnant. She came back to her parents' place telling them that this man is having anger issues and I'm not going to stay with him during my pregnancy. But उसके parents ने बोला that you fight back, you go back and fight back your reality, your situation, which she confronted. She was bold enough to retaliate physically with him. She said after that incident, मैंने उसको after she went back to the home, अगर उसने मेरे पे हाथ उठाया, I also retaliated. I also started putting my needs in front of him whenever he used to treat me badly. She felt abused, but she started fighting back. She faced her husband's temper tantrums throughout the pregnancy. She developed a feeling of retaliation, but the most important feeling which she told me during the last month of pregnancy कि मैं इस आदमी को ये बेबी नहीं दूंगी. I want to kill this baby and I don't want to give this baby to this man who tortured me so much throughout the pregnancy. This was an important uh, verbatim, which was this was an important line which I converted into the rubric. And this kind of hyperactivity you are able to see in the children also. She was restless. She wanted to go out of this situation. She felt कि मुझे नहीं रहना है इस situation में. आज बच्चे में भी उतना ही aggression, उतनी ही भागने की feeling, not listening, phone फेंक देना, head bang कर देना, वो सारे symptoms the child is also having. The rubrics which were selected were anger, violent, anger, throwing the things around, delusion, strong she is. After coming back from her parents' place, she made herself so strong that she could retaliate and fight back the situation. Ailments from being abused, ailments from abused sexually. She told me that she was sexually also abused by the husband. Then most important rubric is kill desire to child their own. This was the most important rubric in this case. And the remedy selected, you can give the suggestions of the remedy. Nobody could guess the remedy. It's a simple one. Suggest the remedy. It has to be an interactive session. It's not a simple remedy. It's androgenous 1 m, one dose which I prescribe. Now I am open for the question and answer session. And in the next webinar, I will be discussing more such cases, more such wonderful cases. Anybody wants to ask any question?
So, ma'am, we have rest presentation also to cover the internal stress factors.
Okay. We'll continue the next session with more cases, with more understanding, with more knowledge.
Okay, ma'am.
And now we'll discuss with more cases, more suggestions, and more discussion should be there rather than I teaching everybody. There should be more discussions, more input should be there.
Of course, ma'am. So, ma'am, we do have questions,
Okay.
and our attendees has also given inputs in the session. We have their responses in question answer session.
Okay.
Let's have a look on the audience response.
Q&A. Okay.
Like Dr. Khushbu Somania has guessed the medicine Tarantula. Parshava guessed the medicine Ignatia. We
Okay.
have
Yes. Got
guesses like
it.
Hipparsus, Sepia.
Ah, okay, okay.
Yes, ma'am.
Copper 2, arsenic. Yes, it was suggested by Neelam also.
Yes,
Clinician also. Jaskaran also suggested the correct medicine.
yes,
Nice.
that's really very impressive.
Supriya. Vaibhavi also suggested the correct medicine. Dr. Khushbu also suggested. Very
Yes,
nice.
very nice. That's really appreciable.
Ailments from neglected being. Jaskaran Singh.
Yes,
Neglected being is a good rubric which we use.
yes, ma'am.
Then support desire for. Yes, in autism case, it was a support which was desired. So Kanishka Sankar has correctly got the rubric support desire for.
Yes,
Vaibhavi has said helpless. Yes, it was a feeling of helplessness. Answering monosyllable, not to all. Because he was saying in a monosyllable, it is not to all, it is answering in monosyllable. So Neelam, it is answering in monosyllable. Delusion being neglected. Okay, it was suggested by Dr. Pranjali. Jaskaran germanium. Yes, very good. He got the correct medicine. Parshava, Ignatia. Parshava, yes. We could have thought of Ignatia, बट इग्नेशिया की सिचुएशन इज मोर ऑफ अ ग्रीफ, दुख वाली सिचुएशन होती है। इग्नेशिया में ट्रैप्ड वाला फीलिंग नहीं होता है। सो देयर वी डिफरेंशिएट, कास्टअवे वाला फीलिंग नहीं होता है इग्नेशिया में। But those feelings of being cast away and being trapped in such a situation was too much. That is why Ignatia say we will have to go to a higher version medicine. Then somebody suggested
Yes, ma'am.
Hipar. Somebody suggested sepia. Okay. Hipar self में it is more of a anger and giving it back. In Hipar self,
Yes.
there is a delirium कि मैं उसके साथ कुछ कर दूं, मैं फायर, आई शैल
Yes, yes. They want their loved ones to, they want
पुट इट
to
ऑन
put them
फायर।
on set on fire. We have
बट इन
such
हाँ,
topics.
बट इन जर्मेनियम मेट वाले केस में वी विल नॉट
Hmm.
थिंक ऑफ हिपार सल्फ, बिकॉज हिपार सल्फ में एंगर रिटेलिएशन है। इन जर्मेनियम मेट देर वॉज नो रिटेलिएशन. So, an anonymous attendee has asked about, has written Hipar self. So, I'm just differentiating the medicines.
Yes, ma'am.
Prerna has written sepia. Why do you think Prerna, sepia is appropriate for the case? It's a good suggestion, though, but how do we differentiate?
So I think she get the CPI idea because it is written that in CPR's mind that it is indifferent to the loved ones.
But she was doing all the work of the family, even if they were not congenial with her, they were not supporting. That is
Yes.
how we differentiate between the remedies. Okay, sepia would have become indifferent. She would have chose a different path.
Hmm.
She would have chose not to work for them who are not respecting her.
Yes. So Jaskaran Singh has said that CPA would have been in aversion to husband rather than aggressive.
Yes, very correctly said that she would have developed an indifference, but she had anger towards the husband.
Yeah.
Yes. And somebody has said, please elaborate about the androgynous. So few symptoms I told you, androgynous के लिए, that there has to be an anger, there has to be an abuse, there has to be a feeling of being abused, being wrongly treated, but androgynous would not take it. She would fight it back and she would find out the means of not getting trapped, rather getting grandiose and coming out of the situation.
Then correct, ma'am.
That is the difference between the androgynous and the submissive remedies. In my video on YouTube, I have differentiated Scorpio and androgynous wonderfully, whereby I have given an example also of differentiation between Scorpio and androgynous by relating androgynous to a character in the movie, that how he
Okay.
takes the revenge and how
Okay.
Scorpion will not take a revenge. So you can subscribe to my YouTube channel and see the difference between the Scorpion and Androgynous. You'll also get the characteristic of Androgynous and how do we differentiate between the remedies. Germanium met
Sure.
we have.
Sure, ma'am. And for the convenience, we will also share the link of the video on your session page. And soon you will receive the whole session recording on the Homeopathy 360 YouTube channel.
Okay.
And we will also upload the presentation on Homeopathy 360 education session
Okay.
so that you can revisit the presentation.
You all can.
Yes. And you can also share your reviews about the session and about the cases. We will be
And
very
we'll come up
happy
with more
to,
wonderful cases.
yes, we have other cases too to share with you. And ma'am, like session like these, we in your session we see the cases in which mind symptoms are very important. So so the conclusion of the cases I grabbed, like that finding rubrics is very important,
Yes.
especially the mind rubrics. And sometimes patient are saying in the words that I have this, I have कि मेरा ये मन करता है, मेरा वो मन करता है. Important ये है कि उन symptoms को आपको rubric में convert करना है.
Verbatim is
Right.
most important, which most of the people struggle, most and most
Yes.
of the people struggle.
हमारे मतलब हमारे आगे rubrics होते हैं, पेशेंट खुद देता है, बट वी डोंट नो कि अच्छा ये सिम्टम का इसका मतलब ये rubric है.
Yes. That I also struggled
Yes.
for many years. I've struggled कि ये क्या बोल रही है, how to interpret
हाँ.
it, ये इसकी इंट्रा यूट्राइन में ये क्या कहना चाह रही है, कैसे ट्रीट किया
Exactly.
गया था इसे, है ना, how to convert it to. Then I went to reading a lot of rubrics की
Of
इसका
course, ma'am.
इसका
And
मतलब.
ma'am, we see that in our Kent uh, repertory, mind section is the biggest. So it is the biggest chapter for a reason.
Actually, we suffer because of the mind only. It is only the mind because of
Clearly,
which we are suffering. So we
clearly. So it's very important to study the rubrics and how you convert your symptoms into the rubrics. It is very important to learn the rubric first. And ma'am, any suggestions you want to give the students and physicians that how to study rubrics or how to learn? Any tips?
first of all try to interpret what she is saying. उसके लिए आपको साइकोलॉजी की बुक्स पढ़नी पड़ेंगी
Mhm.
कि जेलिसी किस में है ना,
Exactly.
why is she saying this thing. It's हमेशा पेशेंट सच नहीं बोलेगा. This is
Totally.
the most important thing.
Hmm.
She or he will tell you only his part. Now how are you going to analyze that situation, जिस situation में वो है ना, what are the feelings, basically what are the emotions, how do we have to conclude them, and what is she trying to say. So for that, you need to have a lot of psychological analysis. For that, you need to read body language of the patient. Patient ऐसे बैठा है, सल्फर का
Exactly.
patient ऐसे बैठेगा,
हाँ, exactly.
है ना, and
Observation
phosphorus the
हमेशा साथ
patient,
रखना है.
he came and he was sitting like this
Yes.
for his patient. Then you see a lot of borax patients who are, mummy is putting the baby down. जब बहुत सारे
Hmm.
केसेस आने लग जाएंगे ना, तब you'll
Tab jab. Exactly.
oftenly
Yes, sure, ma'am.
when she is
So,
putting the baby down, he's crying. Then chamomilla, shrieking cry, which you will get as soon as the child enters the clinic. You will hear from your ears.
hmm,
जैसे इंटर किया वैसे ही श्रीक करना शुरू, वो अलग ही नॉइस होती है. दैट यू एनालाइज की हाउलिंग है, श्रीकिंग है, वीपिंग है. यू शुड नो द डिफरेंशिएशन
exactly.
ऑफ
Differentiation is important for
डिफरेंट.
selection of simillimum. All right, ma'am. It's time to wrap up,
यस.
and many audience is asking for the reference of the books you want to suggest. And I would like to say that in the YouTube description of this session video, ma'am will suggest you some books, and we will link up the books links in the YouTube channel so that you can purchase those books. All right. And for the reviews, please put down your reviews and suggestion, your comments on the YouTube session. We will upload it soon.
You all can give, get back with the questions. You all can ask a lot of questions, and you will see that knowledge is increasing day by day. When
Yes,
you have a curious mind, your knowledge gets increased.
exactly. All right, ma'am. Thank you so much for your time.
Most
And
welcome.
thank you so much for this
Welcome.
wonderful case
360.
presentation. The session was very informative. Thank you so much,
Thank you
ma'am.
so much. Thank you, Mansi.
All right, ma'am.
Thank you, Homeopathy 360. And leaving the session?
Yes.